Okay, now when we have a pregnant with no symptoms and just positive beta HCG, first we do history, then physical exam, and then we do ultrasound. Now routine labs for everyone. We do the type, we do antibodies,
Mm-hmm.
we do RH, we do CBC, BMP, pap smear, chlamydia, rubella, syphilis, urinalysis, urine culture,
Mm-hmm.
hepatitis B virus, and HIV. But the one at risk, we do it. We do gonococcal. We test for TB. We test for RBC indices if there's risk of thalassemia or something like that. We do hemoglobin electrophoresis for some patients.
What do we do with the RBC indices? What
Like if
specifically?
there's if there's if there's hemoglobin low, and
Mm-hmm.
then we do the RBC indices. So if the MCV was low and the RDW was high, that's iron deficiency. But if the
Right.
MCV was low and RDW was low too, that's a thalassemia. Okay. Then some patient we can test for hexosaminidase. Okay, that's a low yield. Some patient we test for cystic fibrosis. We test for phenylalanine,
Okay. How
toxoplasma,
for
hepatitis C
hexosaminidase?
virus, huh?
What do we use? How are we going to use for hexosaminidase? How are we testing for that? And how are we testing for phenylalanine?
There's like, yeah, now and there are counseling. We counsel them about the frequency of visit. We counsel them about nutrition, about weight gain,
Mm-hmm.
about the exercise, regular exercise, rest, and safe sex technique that we. And then we do routine pregnancy monitoring. We can do listeria and toxa precaution counseling. And then we counsel about no alcohol, cigarette, or drugs, illicit drugs. And then we counsel for safety. We counsel about seat belt. Okay. And then we counsel about child and breastfeeding classes.
There's such orders like that in the exam?
No, no, that's not important, but just for completion. But the other ones are like seatbelt, safety, no alcohol, listeria.
Yeah.
Yeah, those are important, but some of them,
Is
no.
how can we even put frequency of visits, right?
No, no,
Like,
yeah, those are not important. Like just some of like for nutrition, you put the exercise,
yeah.
rest, so you can put these orders. And now for follow up, okay, and the people at risk, you do glucose tolerance test at 24 to 28 week, okay,
Mm-hmm.
and you do initially test for glucose, but if the patient more than 25 or obese, family history of diabetes, okay, if the weight, if increased weight, recurrent pregnancy loss, recurrent abortions, okay, for this patient we test for glucose tolerance test at initial visit. Okay, so those are the important stuff. Now for monitoring, you schedule follow up in 4 weeks. That's an important. And just outpatient. You don't need to admit or anything. And there is no timing. There is no need for timing here.
Okay.
Okay. No critical about timing. Okay. So that's about pregnancy.